Chairwoman, thank you. I know this has been talked about. I've watched a bit of the hearing from my office this morning and into this afternoon, but would you highlight for me, I suppose this is for Dr. Woodcock, lots of funding, I think adequate funding, certainly knowledge about winter months would bring an increase in cases. What's the challenge in not being better prepared for access to testing in-home and elsewhere? And how soon will that change?
I don't think that's, I think that's a question for Assistant Secretary McConnell. But I would tell you, FDA has approved or authorized over 400 tests or collection systems just for COVID. We've authorized 15 over-the-counter tests, but it's capacity that we're talking about here, production capacity.
So there's no, what you were telling me, Dr. Woodcock, is there's no problem with the FDA approval of tests. It's the manufacturing process and the supply chain.
We could do more with more resources. We have authorized over 2,000 different device products, including the 400 test-related products in 2 years. So that's an incredible increase in the workload, and we really appreciate the funding that Congress has provided. However, the test manufacturers, many of them give us incomplete results. We have to go back and forth with them. The ITAP program that we are doing with NIH for home testing, I think will improve that tremendously. That's a big advance forward. But there's also the matter of production capacity with this huge surge and so many more people becoming infected.
Is there a separate FDA results process in which the test is read and determined positive or negative? There's no challenges there in that process?
That's what the ITAP program over at NIH is doing. They're actually doing the laboratory and clinical testing for the manufacturers, and then they send us the data. And so it's standardized and it's a panel, and that is really accelerates our ability to get these authorized very quickly. As I said earlier, we've authorized them within 2 days of getting the data from the ITAP program. So as that's a tremendous setup that I think is really beneficial, where we have standardized testing by scientists in the government, and that enables the manufacturers to get their products through very fast.
Thank you. Ms.